I'm here today representing patients, representing my mom, who is locked on a dementia unit, locked down at a Medicaid nursing home in Long Island. I'm here to tell you that after a devastating car accident, she was not expected to survive, but instead she made a miraculous recovery and even had me. And through the benevolence of the TBI waiver program, she was able to live an independent life for a long time until her physical health declined 20 years later. In order for her to be eligible for the care that she needed, we were forced to leave the TBI waiver program, who gave her independence and dignity, and forced to join an MLTC. And since then, what started with denial of medical equipment at home, inadequate staffing of aides at home, and insurmountable barriers to accessing treatment at home, has now only evolved into the denial of medical equipment at the nursing home, inadequate staffing at the nursing home, and even more insurmountable barriers to accessing care at the nursing home. Plain and simple, my family has fallen through the cracks of our system. I've sacrificed countless opportunities and missed out on my life because someone had to keep track of every medication denial. Someone had to keep track of every wheelchair or mattress that was denied her that would fit her body. And every doctor that wrote her off as a case too complex and too expensive. Someone needed to fight for her, and I do, because she is worthy of care.
Yeah.
Each and every one of us are. A phrase that my mom says often to deal with her situation is, "It is what it is." But I'm here today to say that it doesn't have to be. In what world should anyone have to fight for care? For decades, we've made the choice to let greed and profits dictate our healthcare decisions, and we, the people, are living with the effects of a system that doesn't center care, but the profits of a small few.
Yeah.
So today, on my only day off of work this month, it's my honor to stand here, surrounded by the medical community and everybody else behind me here, to urge our legislators to make a different choice. A choice that centers care. A choice that centers my mom, me, and every single one of us, shouldering the impossible burden of caring for the vulnerable while fighting the impossible battle of caring for ourselves in a system that does not care for us. The choice is the New York Health Act to ensure access to care for all and to lay the groundwork for the rest of the country to follow suit, because we're New Yorkers and we show people how it's done. The benefits and returns when you invest in people are tenfold, yet it's the only choice we haven't made yet. So make the right choice, choose care.